My name is Amy Attaway. I'm a pulmonologist and an assistant professor of medicine at Cleveland Clinic, and I'm associate director of the COPD Center. What are the symptoms of COPD? So typical symptoms of COPD include cough, wheezing, and shortness of breath, usually on exertion. So cough, you'll have a persistent cough that will sometimes produce mucus that can be clear, or it can be different colors like white, yellow, or green. Wheezing, this is a high-pitched whistling sound that you can hear often in the evenings or at nights. You can hear this. This is a common symptom in COPD. And then shortness of breath, you'll experience this with COPD, and it's often on exertion when you're doing physical activity. What kind of medications are used to manage COPD? Medications for COPD typically include two different classes. One is our bronchodilators, and one are anti-inflammatories. The other thing that's unique about COPD is that medications are often delivered to the lungs directly, like through an inhaler or through a nebulizer. The other class of medications I mentioned were anti-inflammatories. These usually work, they decrease inflammation in the lungs and help prevent COPD exacerbations. These medications include inhaled corticosteroids, azithromycin, and there's an oral medication that's also a phosphodiesterase inhibitor known as roflumilast. How common are respiratory infections in COPD patients, and how can they be prevented? So for COPD, the lungs have been damaged, and they're more susceptible to infections from bacteria or viruses. And also, patients with COPD have a compromised immune response to fight infection. And so they're more prone to pneumonias, bronchitis, and these can be triggered by viruses or bacteria. To prevent respiratory infections, it's very important to get vaccinated. You should be up to date with your flu shot, your COVID shot, and your pneumonia shots. Other ways to prevent infections are having good hand hygiene, avoiding close contact with people who are sick. Consider wearing a mask, particularly during cold or flu season, and just make sure you're using your inhalers properly so your medications are working properly and they can help keep your airways open and help prevent infections. What kind of lifestyle changes can help manage COPD? One of the most important things is a regular exercise routine. COPD causes inflammation in your lungs, but it can also affect your whole body. It can also affect your respiratory muscles and make it harder to breathe. The other really important thing in COPD is having good nutrition. So it's important to make sure that you have really a good amount of protein in your diet, which will help maintain your muscle. And we recommend the lean proteins like chicken or fish. Other important things include breathing techniques. These you also learn in pulmonary rehabilitation. These can help relieve some of the breathlessness in COPD. And again, the best thing you can do if you have COPD is to quit smoking, which could irritate your lungs and could cause problems for your COPD. How can someone avoid irritants that may make their COPD worse? Like I mentioned, if you're currently smoking, it's very important to cut down or quit smoking or vaping, and try to avoid secondhand smoke exposure as well, because these are irritants that can make your COPD worse. The other thing is trying to avoid indoor or outdoor air pollution, because these can also irritate your lungs and make you prone to exacerbations or infections. Like I had mentioned, be up to date with your vaccinations. Cold, dry air can trigger COPD exacerbations as well, so consider using a humidifier if you're in a really dry environment, or try to avoid exposure to cold air